I've described Vanderbilt as fertile soil. I'm Sandy Muchis, and I'm the Med-Peds Program Director here at Vanderbilt University Medical Center. One of the strengths of the Vanderbilt Med-Peds program are the two core departments that we stand upon. That is the Vanderbilt Internal Medicine program and the Vanderbilt Pediatrics program. From the strengths in the clinical experience and in the didactic experience and the mentoring experience in both of those categorical programs, we grow a rich combined program based on the shoulders of those two giants. One of the greatest joys and biggest parts of my job is really the professional development of our 24 Med-Peds residents.
At Vanderbilt, our goal is to prepare and to train leaders in whatever field you may choose. Two of the most uniquely Med-Peds parts of our program are our Med-Peds Continuity Clinic and our Med-Peds Weekly Conference. Our weekly Med-Peds Conference is really a highlight of our program. It's a time when faculty and residents, regardless of what we're doing during the day on inpatient medicine, inpatient peds, or in a clinic, can come together and be Med-Peds together. One of the main focuses I have is resident education in our Med-Peds clinic. We see patients with more rare and unusual conditions who use Vanderbilt for specialty care, and we also see patients looking for community-based primary care. We see a mix of adults and children combined in our clinic together here every day.
It allows us to bridge the gap between pediatrics and adult medicine. What they've done with the Med-Peds program is take the best of everything and combine it into one just great Med-Peds program.
In my continuity clinic, I might see a 2-week-old followed by a 90-year-old. One of the things that I have been doing this year is been working as one of our clinic chiefs. I knew coming into medicine that I wanted to do primary care, and we have such incredible primary care mentors here in Med-Peds that I have felt very supported in that decision.
The Vanderbilt Med-Peds training program can prepare you for whatever career choice may lie ahead. Our residents and graduates do not all look the same. We have a wide array of diverse careers that residents choose.
We help residents envision their ideal career.
So knowing that I want to do a pediatric cardiology fellowship in adult congenital heart disease, I have been thinking about getting involved in research and other things to strengthen my application. So I found great research mentors on both the medicine and the pediatric sides.
I'm interested in GI as a long-term career path, and I want to stay with internal medicine and pediatrics.
In my primary care continuity clinic, I just got interested in working with the program for LGBTQ health at Vanderbilt when I was still a resident. So I graduated residency and became the lead doc taking care of transgender folks at Vanderbilt and really in the entire state of Tennessee.
There are really a multitude of options as far as specialties go. I mean, certainly you could specialize with anything within pediatrics or anything within adult medicine.
Not only are we exposed to all the subspecialties essentially, but we rotate through services that admit directly to the subspecialists. So you get to really see the kind of inside lens and the expert view when taking care of these patients with specific problems.
It opens many doors, and honestly the hardest thing is deciding which door that we want to step through.
I'd like to say that our program doesn't have a phenotype, that our phenotype is academic excellence and kindness.
It's a lot easier to train when you feel like you're part of a team, when you feel like you're part of a family, when you know that folks care for you.
The residents all take care of each other and look out for one another. Part of my job is to let the residents know that I'm here for them.
I had a baby boy 7 months ago. Having a baby during residency has certainly been a challenge, but it has been wonderful, and the folks at Vanderbilt have really made me feel supported in my new role as a mom and a physician.
With all the difficulties that come with residency, but also supporting each other through all the good times as well.
There is an environment of collegiality here.
The people really make the difference here. You got folks who are, Nobel Prize winners who are happy for you to just shoot them an email cold and sit and talk with you over coffee about what they're doing and how you can get involved.
I think if you come to Vanderbilt, you'll see the strengths being the residents themselves, also the leadership, in the sense of helping you find what you love, what your passions are, and really helping you strive towards those.
Every day I'm astounded by my peers and how smart they are, but also how thoughtful and kind they are. And I think that's really important in medicine and really important in residency, which can be hard.
And beyond that, with those core values, you can do anything.